Welcome, Monterey County parents and community members, to this COVID-19 testing for school-aged children session generously hosted for us today by Community Hospital of the Monterey Peninsula. I'm Dr. Deneen Guss, Monterey County Superintendent of Schools, and I am so pleased to provide you another COVID-19 information session to learn about student testing strategies many schools in California, including programs of the Monterey County Office of Education, are currently exploring. This is our second webinar offering for our county, hosted by CHOMP, and we're thrilled to have them as a partner in educating our community about safely returning to school. To briefly review what we're going to be discussing here today, student COVID-19 testing is another mitigation strategy, like wearing a face mask and social distancing, that the state of California currently encourages. The state has purchased 5 million Bionex Now antigen test kits and distributes them to districts at no charge. With training over the internet, state health officials train school staff on the testing procedures. Testers don't have to be medical and health professionals. Here in Monterey County, our County Office of Education is piloting this program with our students, and students at the International School of Monterey are also performing regular COVID testing. Other districts are exploring the possibility of launching student testing as well, and today's webinar was organized to inform and encourage parents to participate in testing if it is offered within your student's school. These tests work by inserting a cotton swab in the front part of the nose for about 15 seconds. Students can self-administer in front of a trained staff member. One elementary student in a news video said, "It kind of felt like tickling." To be clear, this is not the tickle your brain type of test. It's a lower nasal swab the student does themselves. I'd like to now show a video of several students performing the tests while a doctor explains the process. So at this time, I'm going to turn it over to Jessica, and she'll share the video.
This video demonstrates an anterior nasal swab test and was made to help instruct students to do this test on their own, to self-swab. To protect myself, the protective equipment or PPE I need are gloves, optional but recommended eye protection such as goggles or face shield, and a mask. Start by standing at least 6 feet apart from the other students. The teacher is going to help you wash your hands before you do the test or give you some hand sanitizer. First, we are going to hand you the swab. You're going to want to take a stick and be careful not to touch it with anything. You don't want to touch the soft part of the swab. That part needs to stay clean. You're going to hold it and wait for instructions. And then when we say so and we are far enough away from you, we are going to have you take down your mask beneath your nose. You're going to take your swab and put it in the front part of your nose like you're picking your nose. We are trying to take a sample of your snot. You want to both twirl the swab around as well as move the swab in a circle around in your nose, gently touching all sides of the inside of your nose at least 4 times. We are going to do this for a total of 15 seconds. So let's count. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15. Then we will take it out and put it in the other side. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15. Then take your swab out and hold it without touching the soft part. Put your mask back on over your nose and wait patiently for one of the adults to take it and run the test.
Quick and easy. The student swabs themselves, hands the staff member the specimen, and then in 15 to 30 minutes, staff members have a result, either positive or negative for COVID, that they then share with the parents through an app. Negative and positive test results are shared with the parents and public health officials only. No test results are shared with other families. This program is one that schools throughout the state are exploring. And again, while the tests cannot be required, we are holding this informational webinar today to ensure that parents understand the importance of agreeing to student testing if it is offered within your school district. It is my pleasure to welcome and introduce our co-host today, Dr. Martha Blum. She will review the benefits and importance of testing for community immunity, the different types of COVID-19 tests available, and the process of reporting student test results. Dr. Blum is a board-certified infectious disease specialist and is the medical director of infection prevention at Community Hospital. She received her medical degree from Cornell University Medical College and completed her residency and fellowship in infectious disease at University of California, Los Angeles Medical Center. She has a doctorate in medical virology from Rockefeller University and was assistant professor of medicine in the Division of Infectious Diseases at UCLA before she joined the Montage Medical Group. It is my pleasure to turn it over to Dr. Blum to discuss the importance of testing and differences in types of tests. Dr. Blum, take it away.
Thank you, Dr. Guss. Thank you for such a nice introduction. And I hope everyone enjoyed watching that video. I think many kids would enjoy the opportunity to be able to kind of pick their nose in front of the adults at school. So, let me just go back and talk a little bit about how testing is only one part of a comprehensive program for preventing transmission of COVID-19 between people when they're gathered in public settings such as schools. So the test is only one part of it. Everyone should be doing the same basic prevention measures, like continuing to monitor themselves for symptoms, doing those daily health checks before going to school, and taking it very seriously to stay home when symptoms are present. I know that sometimes that can be a little tough to think that maybe it's just a case of the sniffles, but in our current pandemic, right now, we need to take all of those symptoms very seriously and stay home when ill and seek out testing when ill. So other parts of a comprehensive prevention program aside from testing include the masking, the symptom monitoring, and of course, for those who are 16 years and older now, vaccination's also a key part of that. And I did want to mention for those of you who are in high school or are parents of the children, right now, vaccine is more readily available all throughout the county. Anyway, back to today's message, which is about using testing as one part of that prevention strategy. What was just demonstrated in that video was doing the swab test for the coronavirus. Now, people are probably familiar that there are kind of two basic types of tests, one of which is a blood test, and that only shows whether or not you've had antibodies or a reaction to the virus. So we're not talking about the blood test looking for antibodies or immunity. We're talking about swab tests that actually look for the virus, either the proteins of the virus or the nucleic acid of the virus. And the reason that small distinction is made is because, again, the test that we're talking about, the Binax now, is an antigen test. It's a swab test looking for viral proteins. So it's very sensitive for detecting whether or not the virus itself is present in the nose or the upper airways, signifying that somebody could be possibly contagious or newly exposed and becoming contagious with the virus. So as you can see, these swab tests are getting much easier and less uncomfortable than the original ones, which were, as Dr. Guss described, the brain ticklers. These are not. These are done in the nose. You don't have to tip your head back. And as you can see, even children, very young children, can collect the specimen themselves under the supervision of an adult to be sure that they get an adequate specimen. It's very important for there to be supervised specimen collection because, again, one of the reasons these tests could fail is because of inadequate specimen collection. Either the swab wasn't done on both sides or wasn't done long enough. So again, self-collection with these nose swabs can still be used for these very sensitive and specific antigen tests. The other type of swab test people may be familiar with or have heard about or even had done themselves are the PCR tests. Now, those are still considered by public health authorities to be the gold standard for diagnosing COVID-19. And they can be done similarly with a nose swab and done for surveillance purposes. The difference with those PCR tests is that they take much longer to get the results back. They can't be done necessarily at the site of collection very easily. So for part of a prevention program where you want to know sort of on the spot within 15 or 20 minutes whether or not somebody may be carrying some of the virus in their nose or upper airways, these antigen tests are really the quickest way to do that and have the results right away. So I can tell you, as already was described, that these are being done already here in Monterey County at some school locations. They're also being explored for school athletics, so for practices or competitions. They could be used for all the participants just prior to the onset of the activity, so that again you have that added layer of prevention and safety going into something where, again, social distancing is just not possible with some of these contact sports. I mean, that's the whole point. So it is, again, like I said, one part of a comprehensive plan. So a couple of things about the antigen tests. Like I said, they're done very rapidly, and they can be positive in a number of different scenarios. The one we're looking for is, of course, that somebody who may not be having symptoms but is carrying the virus and could be contagious. So that's the most likely scenario when you have one of these tests turn positive. And you may be at some point asked to go to a healthcare provider and have the PCR-based test done afterwards. Again, that would be completely determined based on the procedures and protocols in place at the particular school or event where you've had this rapid test done. The other thing to note is that people who have had COVID-19 and recovered may continue to have some of the viral particles still in their nose, sometimes even for weeks or even for a couple of months after they have recovered from illness. So that's another possible scenario where someone might have a positive test. So that, I know, in some cases has led to some situations where people were known to have been positive and continue to be positive even though they're no longer contagious. So that, again, is a situation that if you've had COVID-19 or you know that your child has had COVID-19 and has recovered, you would probably want to say something or let the tester be aware of your prior diagnosis of COVID-19 and the timing of that so that they can properly interpret the results of these rapid antigen tests. And lastly, I just want to point out that no test is 100%. They don't work perfectly 100% of the time. It is possible to have both false positive results, meaning the result is positive even when the virus isn't really there. And you can also have false negative results, meaning that the test shows negative even though the person may be in the very earliest stages of infection and may indeed be contagious and infectious even with a negative test result. Now, because of that, no test being 100% all of the time and the possibility that someone could still be with the virus and contagious with a negative result. That's why we continue to encourage people to use all the other measures in our prevention toolkit, including the mask wearing, keeping distance when possible, keeping our hands clean, especially cleaning our hands before eating or drinking or touching our nose, face, or mouth. Those things are all going to be very important. And as I mentioned at the start, vaccination is probably now one of the most powerful tools that we have for prevention. But unfortunately, that prevention measure won't reach our youngest school-aged children. In the short term, we're still waiting for the approval to use these vaccines in younger children. So hopefully that gave you a good overview about the antigen test, how it works, and what are the benefits of doing that. Is that, you know, there's still the possibility a lot of people can be infected and contagious and just be completely asymptomatic. So this is a final fail-safe against that possibility. And once we know where there may be pockets of people who are asymptomatic and spreading the infection, we can work very quickly in conjunction with our public health officials to quickly isolate and quarantine those who may be exposed so that we can prevent further transmission in the community. Yeah, I'm very happy to see that transmission in Monterey County remains quite low, but it's not zero, and it's remained stable now for several weeks. So this testing is really a great opportunity for all of us to really do our part to find out where there may be the last little holdouts of the virus in our community and be able to really drive that transmission down to zero. So we'd be happy to take your questions, any specific concerns that you have about the tests or how it's done. We're happy to provide more information for you.
Thank you for sharing this very important information, Dr. Blum. I so appreciate you being with us today. I know we do have so many questions. Before we turn it over to our parents and give them the opportunity to ask some questions, I just wanted to ask you, why, if I'm a parent, why would I want to consider asking my child to participate in a testing program like this? Would it be helpful to me if my child was at school and all of a sudden they got a headache or they started to not feel well? Might this be a good mitigation strategy that would let them know right away whether or not I should be overly concerned about a headache or something like that, that typically happens even when we didn't have COVID?
Right. Yeah, I think that's an excellent point, Dr. Guss, that, like I was saying, that, you know, the symptoms of COVID-19 can be, you know, pretty mild for most people. And so how you can distinguish it from just another headache or another case of the sniffles, or of course, children can get illnesses with fever of all varieties. So how do you know that, you know, that's not what's developing is COVID-19 versus one of the other more common causes of those types of symptoms. So doing this routine surveillance testing can be really helpful as an initial starting point. So participation with in a testing program, again, allows everyone coming into the building, you know, that added layer of protection and confidence to say that it is safe to be back in school. It's safe to be back for in-person instruction. It allows all of us to, again, gather together without having to, you know, continue to stay at home on Zoom and on screens, but making real connections between teachers and students, you know, and so the testing is yet another important part of that whole program for COVID prevention and mitigation. Now, I do want to say that if you're a parent and your child is having symptoms, including fevers or headaches, I would not recommend you take them to the school to get tested. You know, the testing being done at school is being done on children who don't have symptoms and have presumably already passed their health screening. But, just so you know that there is the availability to do these tests very quickly and get results within 15 to 20 minutes that can further help you decide what are the next steps you should take to care for your child who may be having symptoms that are new and different for him or her.
Great. Thank you. Another question that I have been asked frequently is, what testing cadence would you recommend for schools? Like, should they offer rapid antigen tests once a week, twice a week, more frequently, less frequently? What are your thoughts on that piece?
That's a great question. The thing about doing the swab tests looking for the virus is that that result is just one tiny snapshot in time. It's really only about that day when that test was done. It doesn't let you know what may happen 3 days from now. So that does get people, in the frame of mind of, oh my goodness, do we need to be testing all the time, every day? Well, there's probably going to be a nice balance between doing this and getting, good surveillance testing and doing it so frequently that you may be getting into problems with, those false positives and things like that. So in general, I wouldn't recommend this necessarily need to be a daily routine, but this should be something that if it's being done for surveillance purposes, should be done fairly regularly, every week or two. I can tell you in the healthcare setting, our most vulnerable patients who are living in skilled nursing facilities, so in rehab facilities or nursing homes, they are continuing to do surveillance in those facilities on a weekly basis or a bi-weekly basis. So again, if we're talking about, a large population of unvaccinated children, and if particularly there are vulnerable people around, that might be a reasonable time frame for repeating the testing. The other thing that we know is that the incubation period between the time that someone may have been exposed to somebody who is contagious and the time that they become contagious or symptomatic is about 5 days. So again, if somebody has a negative test and they don't know of anything new or different going on in terms of symptoms or exposures, doing the test again within a 5-day period may not be that helpful. So I hope that's helpful to some people who are planning testing programs in terms of what the frequency might be that could be helpful.
Great, thank you. Well, I know that questions are coming in, and we have Jessica Hull, our communications officer, they're just creating that list of all those questions right now that our parents want answered. So with that, I'm going to turn it over to Jessica to share some of the questions coming in from our parents. Jessica?
Thank you, Dr. Guss. First question, if I have a test that is positive from the school, so a positive rapid antigen test, do you recommend that we follow up with a PCR test, one that would be more accurate right after? And if so, will the schools tell me where I can go? And I know Dr. Guss can share what the Monterey County Office of Education is going to be doing because we are offering PCR testing as well. So Dr. Guss, do you want to talk about that?
Absolutely, yes. Here at the Monterey County Office of Education, we do have our COVID testing team that does conduct PCR testing. As Dr. Blum mentioned a little bit earlier in her presentation, the PCR test results aren't very rapid. It can take between 24 to 48 hours to get those results. So that's why this rapid antigen test piece is, I think, a good addition to our testing program. So for us, the way this would work is if a student tested positive on the rapid antigen test, then we would simply administer the PCR test to that student right away. And again, it's the same tested COVID testing team that would administer that PCR test. What we would have to do, though, is we would have to ask the parents to make sure that the platform by which they receive the results, that they have registered on that particular platform, because the platform that sends the results for the rapid antigen tests right now is a different platform than the PCR test platform. And I hope that answered that. If not, Jessica, please feel free to explain that whole technology piece just a little bit more so that our parents will understand how that piece works.
Yeah, no, I think that was a great explanation. And I think it's important to share with parents that the Binax Now test, if you have a positive, the next step is a PCR test. So the parents aren't going to be asked to try to go find a testing site. They'll have a PCR test available for them right at that moment. Our second question, Dr. Blum, if my student has been vaccinated, does that mean that they would test positive on a rapid antigen test?
Yeah, that's a good question. So as I was saying, there's two kinds of tests. There's a blood test and there's the swab test. Once you've been vaccinated, you don't have the virus in you. The vaccine doesn't infect you. It just stimulates your immune system to react to the virus. So your blood test to look for antibodies to the virus after you're fully immune will be positive. But these swab tests, which are actually looking for viral particles or, the viral genome, the nucleic acid, those are only positive when infection or the virus is present. So to answer the question, if your child has been vaccinated, we would not expect that to make the swab test positive. Only infection or prior infection would be expected to give a positive swab test.
Thank you. And can you clarify, if they have been COVID positive, how long might it be that they would test positive on one of these swab tests?
Right. So once somebody has had COVID-19 and recovered, they can continue to have viral particles, even though it's kind of a dead and activated virus and not a contagious virus. That can still be detected for up to 90 days following infection. So it can be quite some time, particularly if a person has an immune system that is impaired or weakened for any reason. Those tests can remain positive for that period of time. So currently, the Centers for Disease Control does not recommend routine repeat surveillance testing of people who were known to be COVID-19 positive for the 90 days following their diagnosis. The thought there is that even though the test may remain positive, they're not contagious and they're not likely to be causing contagion, or they would not be infectious to people around them for that 90-day period.
Great. Now, this person had thought that children didn't have bad COVID symptoms or couldn't transmit COVID very easily. So why should they test if they can't transmit COVID very easily, or if they don't seem to have any sort of long-lasting symptoms if they do have COVID-19?
Right. So it does appear that COVID-19 does affect children differently than it affects, older adolescents and adults. But it is true that children can get severe disease from COVID-19. There's also a particular entity in children of a very overactive immune response that can give children this inflammatory syndrome that can be quite debilitating with high fevers for a prolonged period of time. And that's very particular to children, not really seen in adults. And although it may be that children don't appear to transmit infection to adults or to others around them, perhaps as readily as adults, they can still be infectious and contagious to those around them. So even though in all likelihood the children may not become as ill as adults, they can still get quite ill and they can still be contagious. So it's not a zero chance that they would be able to transmit it. So and of course, according to our local public health authorities, anyone with symptomatic COVID-19, regardless of age, needs to isolate. And I can tell you that from personal experience, we've seen infants as young as just a couple months old having symptoms and trouble breathing and high fevers related to COVID-19. So even in young children, it should be taken very seriously.
Thank you. Once vaccines are available to people of all ages, so 0 to 99 can receive vaccines, will we still be doing testing like this?
Right. So definitely getting the vast majority of people vaccinated, including our children, is going to be the way to bring this pandemic to an end. We're not going to be there for a little while yet. I don't really have my crystal ball working quite as well to say exactly when we'll be able to take off the masks and stop the testing and really be able to back away from all of these basic prevention measures. But I can tell you the way that the clinical trials for rolling out the vaccine to younger children are progressing. We have seen some excellent efficacy and safety data from Pfizer for now children going down to 12 years old, and they're already asking the FDA for the approval to use the Pfizer product in children, again, as young as 12. And also further studies are being done to further decrease the age down to the younger school age children. And usually they go down to about 2 years of age. So there are not many ones that would go, I think, younger than 2 just yet. But that safety and efficacy data is still underway. It's still being collected. It still is several months to get that information for the younger children. So I would imagine it will be perhaps into the next year, 2022, before we're going to have the vaccination open to, as you say, everyone from 0 to 99. So until that time, and until we really see the transmission of this virus in our communities going to near zero, we'll still be encouraging testing as a means of doing surveillance and as a means of really controlling the transmission within our community. The other thing I want to point out too about testing and sort of basically surveillance for this is that as we begin to feel more comfortable of loosening these restrictions, there's going to be more people feeling more comfortable traveling, not just within our community, but outside our state and even outside our country. For anyone who's following the news, you know very well that although the current situation in California and the United States is clearly improving, in other parts of the world, this pandemic is far from well controlled and far from being over. So for as long as there's worldwide high levels of transmission in some places, there's always the possibility that this situation could really rapidly change. So that's why this type of testing, this what we call surveillance testing, getting a good broad examination of where the virus may be in our community is so important. And we are very, very lucky, and I'm very grateful we have such a great public health lab that can do that type of surveillance testing to basically examine the viruses and let us know if any of those mutated variants of the virus coming from overseas are here. So we do have some pretty elaborate testing and surveillance capabilities here in Monterey County. But we only know that information if people get tested. That's the only way we'll be able to find out.
Great segue to the next question. Do you think that tests like this, these rapid swab tests, will be available for purchase and use by the general public anytime soon?
Yes, they already are to some degree. And the FDA, which also not only gives approvals and authorizations for drugs and vaccines, they also do the same thing for tests. So there are now approved a few products that can be used at home. You don't need any kind of physician order. You don't need any kind of medical expertise to collect them. They're very much like this Binax Now antigen test that can be done at home. And thankfully, some of these newer generation at-home tests are a little more affordable. You know, it wouldn't be really helpful, you know, if the in-home tests were, you know, $50 each. I don't know that many people would be able to afford to do that type of testing at home. But now the in-home tests that are expected to be coming on the market, you know, any moment now, they're probably already available online. Somebody will probably correct me. They're only $2 or $3 for each test. And really the intention of those that develop those tests were for people to use it just like the schools are going to use it, which is, you know, use it before you head out for the day, use it before you head out to go you know, gather with a group of friends or go to some sort of outdoor event where you're going to be with people who aren't vaccinated. So, so yeah, be on the lookout. I'm sure we'll see a lot of advertisements for these at-home self-tests very soon.
Thank you so much. Two-part question. Why would you personally recommend that parents allow their child to participate in this type of surveillance testing? And are there any drawbacks, or are there any bad things that could happen or would happen if my child were tested?
Right. Yeah. I have two school-age children myself, and if they were asked to participate in testing, I would say, of course, let's do it. Like, you know, I think that this kind of information is really, really helpful for the whole community. And, you know, right now, after everyone is finally breathing a little sigh of relief and feeling that it's okay to be back in school, in person, engaging in person with the teachers, I would think that anything that we could do as part of a whole comprehensive plan for prevention and mitigation of COVID-19, you know, it's really kind of up to us to make that work so that we can really continue to operate our schools safely. So that's what I would say, is that I think that you know, we really want to keep everybody back together in school and doing it as safely as possible, because none of these things are zero risk, and we just do everything we can to further decrease the risk so that everyone feels comfortable and safe being around each other again. And then the second part was, what are the drawbacks of these tests? Well, I have to say, having you know, been working in healthcare, obviously, these last many months, we've done a large amount of surveillance testing. We do a lot of testing of asymptomatic people who are coming into the hospital for reasons other than an infection. And I would say probably one of the most disappointing things for someone who is not having any symptoms and is feeling perfectly well is to be sort of blindsided by having a positive COVID test. Now, in some certain circumstances, these people will say, oh, okay, that makes sense. You know, I was around somebody who was ill, or they had, in retrospect, some sort of risk factor or some type of exposure. But in other cases, we have found a positive COVID test where, you know, the person has been taking every precaution. And so those are certainly the possibility of having a false positive test. Now, the way that you get around that drawback in some ways is, as we already discussed, is by following up this antigen test with the PCR test, which is considered the gold standard, or sort of the final authority in COVID testing, if you will. So that is something to prepare everyone for, is that, again, when you do this for surveillance on people who are completely asymptomatic and you get a positive result, it does require follow-up. And at that point, all the precautions for isolation and quarantine will go into place until further information is available. So I would just say that. Now, I don't think there are any particular side effects or drawbacks of the self-collection of the nasal swabs. Again, as long as the students are being supervised, I think there would be very low risk of the students injuring themselves in any way while they're doing the swab collection. So thankfully, again, with the supervised collection, it should be really safe for students.
Well, thank you so much, Dr. Blum, for answering all of those questions for our parents and for our community members. Again, I just want to thank you and thank CHOMP for hosting today's webinar. It's so encouraging to hear how student testing can help support our schools and really keep our schools safe. And I just have to say, at this point in my career, I'm surprised that I'm literally finding myself now recommending that our students take the little swab and pick their nose. I spent many years as an educator telling kids, please don't pick your nose at school. All kidding aside, this is definitely a very important strategy. It's just one more tool on our tool belt. So again, thank you for all of your help, for all of your support. I hope each of you have a happy and healthy rest of your day. And we're going to wrap it up by just saying, please stay safe and be well.